This is a first response kit, so in this bottom compartment paramedics have their own medicines which they keep here. In this top compartment we've got an adult BP cuff, we've got a child BP cuff, we've got a stethoscope, pupil torch, some shears, a thermometer, and also a hypoglycemia testing machine. In this top side compartment we've got some PPE such as some goggles, a mask, we've got a spew bag, we've got a cervical spinal clearance lanyard, we've also got some anaesthetic spray. In this bottom compartment here we've got some glucose, we've got glucagon, we've got a drawing up needle with a syringe, and also some oral glucose. We've got the hemorrhage control equipment in this side compartment with 2 combat application tourniquets, some crepe bandages, crepe tape, saline, some gore strips, and also a sling. Moving along into the main compartment, we've got some medications up here, pain relief, such as paracetamol, ibuprofen, and tramadol. Moving down into the next compartment, we've got some McGill's forceps, a laryngoscope, NPAs, and OPAs. In here we've got asthma medications such as ibupropium, salbutamol, and adrenaline, and a nebulizer, and the tubing. We've got an adult BVM, pediatric BVM, we've got an IV roll, we've got an LMA with the Thomas tube holder, we've got a towel, we've got sodium chloride, slippery sand, sharps container, a cardboard splint, and a neck brace. The suction unit. Before every shift a user test must be performed to make sure that it's working. To perform a user test, simply press the test button, hold it down, turn it on. Wait for it to be on the second bar, the hose can be kinked. Now I'm waiting for the lights to go to the top to indicate that it's working correctly. It turns off, this indicates a successful user test. The components of the suction unit are the rigid handle or the Yarnica handle. There's also a soft catheter which is used in a moving ambulance or in paediatrics. The other component of the suction unit is the patient tubing, which is this one here, the vacuum tubing, and also the reusable canister. Okay, so to perform the suction on a patient, they must be on their side, so in a lateral position, preferably in the recovery position. And basically this helps for the foreign body or the fluids to come out of the mouth or out of the nose. It also prevents any fluids going down the airway. Okay, so indications for suction would be a foreign object in the airway, a low GCS, or when the patient is unable to maintain their own airway. So to perform the correct suction technique, turn the machine on. Only go in as far as you can see, and you want to be suctioning on the way out for no more than 10 seconds in a circular motion. Okay, contraindications of suction include induced bradycardia, induced vomiting, hypoxia, aspiration, soft tissue trauma, or laryngospasm. This is an oxygen cylinder. One way to tell this is it is completely white, and it also says oxygen at the top. This here is the regulator, and also before every shift the Bodox seal, which is this here, must be taken out and inspected for damages. To place the regulator onto the oxygen cylinder, simply find the 2 pins and align this with the regulator, tighten it like so. This is the master seal that should be turned to the left, and this indicates pressure in the cylinder. There's also various flow rates over here that can be selected. Indications for oxygen include a TBI, the stats below 94%, also shock, shortness of breath, condition requiring sedation, carbon monoxide poisoning, a decompression illness, and also an airway obstruction. So for the purpose of this video, I'm going to demonstrate how to deliver oxygen to the patient via nasal prongs. So simply insert the nasal prongs into the nasal cavity. And then the other end of the tubing goes into the oxygen cylinder, and then this gets adjusted to 2 litres per minute, and this delivers 20 to 40% oxygen. So to disconnect the bottle, simply turn it off, take out the tubing, and then bleed the oxygen. Take the regulator off. This is a Life Pack 15. In the outer pocket we have the defib pads, which must be attached before each shift. On the inner pocket here we've got chest pain medication such as aspirin, GTN, spare electrodes and a shaver. We've got a shock box in here and a 12 lead ECG. Moving along to the pocket on this side, we've got a 3 lead ECG and also some printing paper. The Wi-Fi box for frontline is kept in this outer pocket. We have the end-tidal CO2 and also the SpO2 sensor. So to plug the end-tidal CO2, we put it underneath this flap here, we screw it in clockwise, and then that's just kept for the ICP paramedic. To take it out, we simply turn it anti-clockwise. In the back pocket here, we've got the spare defib pads as well as an adult, a paediatric and a bariatric BP cuff. Underneath this flap here, we've got 2 batteries. We press this, that's full. This one has 3 bars. To take them out, we just simply press this here and then place it back and make sure it clicks. In the front here, we've got the printing paper. Now, if this is empty, we simply lift this up, and then we can take the paper out like so, and then replace it with a new paper. The Life Pack 15 on, we simply hold down the on button, and we press the lead to go into advisory mode. To perform a user test, we press options, and we scroll down to user test. This will be doing its test. While it's doing that, I'm just going to prepare the shock box. We disconnect the defib pads, and we connect the shock box. So the Life Pack 15 has performed a successful user test. To activate the metronome, we simply press CPR. And one thing to note though is it does not meet the current guidelines of high performance CPR, which is 110 beats per minute. This is a little bit slower at 100 beats per minute. To turn the metronome off, we simply scroll down and select stop. Show you how to perform a test shock. So to do this, I simply press energy select, which takes me into manual mode, and then I select yes. For the purpose of this test, I'm going to select 50 joules. To charge up the shock, I press the charge button. To deliver the shock, I press the red shock button. Energy delivered, this indicates that the shock was successfully delivered. To dump a shock, I press the charge button. And to disarm it, I press the knob here. And then it indicates down the bottom that it was disarmed. Now I must connect the defib pads again because this may need to be used in a hurry out on the road. And also popping the shock box away. To get back into AED mode, I simply press Analyze. Go back into advisory mode to connect a 3-lead ECG onto myself. To do this, you simply press the lead button. Okay, there are also various lead views that can be selected. So to get to them, you just simply press the lead, and here are all the options here. But for today's video, I'm just going to keep it on number 2. I'm also going to show you how you can change the QRS volume. So to do this, you simply hover over the pulse and select OK, and then the volume can be turned up. But I'm just going to turn it off now. Also, the QRS size can also be increased. So to do this, you just hover over the first box, select it, and then there's different sizes that can be selected as well. But today I'm just going to keep it on the normal size of 1.5. Life pack shows the electrical activity of my heart, but this must be correlated to the mechanical output. And to do this, you simply take a radial pulse. Into a rhythm strip, you simply press the print button and let this print for about 6 seconds. To stop it, press the print button again. To make use of the SpO2, simply place it on the index finger. And this measures the percentage of oxygen bound to the hemoglobin in my blood. So at the moment indicating 97%. To change the intervals for the blood pressure, you simply scroll down to the bottom left-hand corner box, and you can select various intervals. But for this demonstration, I'm just going to select 5 minutes, and then select Start. To stop this, press the NIPP button. So to get into night and day mode, you simply press this button. Ways to maintain the patient airway. The first I'm going to demonstrate is the head tilt chin lift. So this is when I place my hand and put it on their head, and then my other hand on their chin, and I'm basically just tilting the head back like so. The other one is the jaw thrust. So this is when I'm placing my hands underneath their mandible and I'm thrusting it upward. The other one is the recovery position, and that's when I place the patient laterally on their side, and this prevents any foreign objects or liquid backlogging down the airway, and it also helps for it to come out either the nose or the mouth. The other position is called the sniffer's position, and that is when you place a towel under their forehead and basically making sure that the earlobe is in line with their sternum. There are also several airway adjuncts that can be utilised to maintain a patient airway, one being an OPA, which stands for oropharyngeal airway. So this is indicated when a patient has a GCS less than 8, a motor score less than 6, or incomprehensible sounds to pain. So first of all, I would measure it. So I'd measure it from the corner of the mouth to the edge of the mandible, like so, and I would insert it backwards, gently into the patient's mouth, inverting it 180 degrees to avoid the tongue. So contraindications for a OPA would be an intact gag reflex, and complications would be damage to the oropharynx. It could be either too big or too small. It could induce vomiting, trismus, or it could cause emesis as well. So the other airway adjunct is an NPA, which stands for nasopharyngeal airway. And this is indicated when a OPA is not appropriate, when they have a GCS less than 8, and also when they have incomprehensible sounds to pain. But it's not, a contraindication would be a head injury such as a base of skull fracture. So first of all, I would lube it up, and I would measure it. So I'd measure it from the knees to the angle of the mandible, and I would either choose the biggest nostril or both, and I would insert it perpendicular to the patient's face, like so. And complications for an NPA would include nasal bleeding or polyps. This is a BVM, which stands for a bag valve mask. We would use this when patients have bradypnea and also a rest rate of less than 12, and when they are poorly perfused. So the components of this BVM include the BVM chamber, which is this piece here. We've also got the PEEP valve, which this is used when patients have pneumonia or also a pulmonary edema. And a contraindication of using this PEEP valve would be in a cardiac arrest or also a pneumothorax. So the other component is the filter. We've got the mask, we've got the reservoir bag, and we've also got the oxygen tubing. Now before each shift, all of these components must be checked to make sure that they're working correctly. So one way to do this is to feel the pressure that the BVM bag puts out. This will indicate that there's no holes in this bag. We would also put the reservoir bag on the end and we blow this up, check for any leaks. Now the correct flow rates for the BVM is between 10 to 15 litres of oxygen per minute, and this delivers 100% pure oxygen. Also for a cardiac arrest it is between 8 to 10 breaths per minute, and a non-cardiac arrest is 10 to 12 breaths per minute. So I'm just going to demonstrate a secret. So that's how you to perform a secret properly. And I'm also going to show you how to do a double-handed grip, which is when you have two hands. And I'll get my offsider to squeeze the bag. So rule of threes. So when doing the rule of threes, that means that I'm using a third of the bag, and I'm using my 3 fingers, and I'm delivering the breath within 3 seconds. Complications that can arise when using a BVM include gastric inflation, barotrauma, hyperventilation, or overinflation of the lungs. And an acronym that we can use to predict difficulties when using a BVM is the MOANS acronym. So M stands for mask seal, it's making sure that it's a correct seal. O is for obesity or obstruction, it's checking for any obstruction. Age can also affect this. No teeth, the neck mobility, and stiffness and snores.